here with Jonathon Fowles, Chair of the National Advisory Council, Exercises Medicine. He's a research chair of the Center of Lifestyle Studies, Acadia's University of Kinesiology, and he did a session for us yesterday at the CRA, Canadian Rheumatology Conference here in Ottawa, and I was so impressed. So I am going to just ask you a couple of questions.
Yeah.
And if you want to go with it, you just go with it.
Sure.
You were excellent yesterday. So
Thank
can you tell us a little bit about you and how you got involved in this field?
Well, I'm an exercise physiologist, and I originally started in the chronic disease area in diabetes. In about 2005, we did some exercise training studies at the hospital and adapted a cardiac rehab kind of program for diabetes. And from that work, I developed resources and tools for the diabetes care program at Nova Scotia, which then expanded to work with the Canadian Diabetes Association and the Heart and Stroke Foundation and various other conditions, which then developed into our national initiative, which is Exercises Medicine Canada. And I've recently become the chair of that program with the goal of promoting physical activity counseling and exercise prescription and support and referral to community resources for through primary care and health care for individuals with chronic disease. So that's how I've come across the Rheumatology Association, and because basically Exercises Medicine is trying to support all individuals with chronic disease and get better support for those. And so, for example, I've been working with the medical program at Dalhousie in Nova Scotia, and the dean of medicine there had heard about me and the work that I've been doing with the medical students there of integrating exercise and physical activity as part of the curriculum. And obviously she's on the planning committee for the CRA, and so then they wanted me to come and speak to you and speak to all the members here. It's been a pleasure.
Well, what you said definitely resonated with me, and
Great.
I'm sure with other people. Well, we already know a few other people. A couple of things that you said. One was sort of what you should aim for in a day for everybody, but especially for people with disabilities.
Yeah. Well, I think the first kind of take-home message from that is any physical activity is good physical activity. So it doesn't matter where you start from. Most of the evidence says that more than where you are is usually better than, so for example, the biggest improvements are from being sedentary to doing some activity. That's where you get the biggest improvements in health, the biggest improvement in outcomes, the biggest improvement in, for example, pain or disability or mobility is actually from doing nothing. And many people are, limited in the sense of what they can do. But just doing a little bit actually helps quite a bit.
Okay.
Now, from that, reducing your sedentary behavior is a first step. But then from there, developing a pattern of regular physical activity. And there's different targets, like our Canadian Physical Activity Guidelines recommend 150 minutes of moderate to vigorous physical activity per week, which that seems...
that would be
seems like a lot,
yes.
right? And that's okay. That would be a far off target.
Right.
So maybe on a daily basis, you might want to try and target 10 to 15 minutes of, physical activity that you can get out and do on a regular basis. And again, that provides significant benefits relative to not doing anything at all.
And if someone were just starting, could that 10 minutes be in maybe 3 to 5 minutes or something like that?
Yeah.
So it doesn't all, the original theory that I remember from school was that it all had to be done all at once.
Right. And our more recent evidence is actually showing that smaller bits are just about as good. And so in our guidelines, they say try and do it in 10 minutes at a time or 10-minute bouts. But our more recent evidence that's coming out even this month, showing that even 2 minutes at a time is actually accumulates towards those goals of 15 or 30 minutes in a day. So if you can do 2 minutes at a time, that's better than doing no minutes at a time.
Okay.
Yeah.
And what kind of, I know that people always have trouble with how vigorous it should be and how to tell whether what you're doing is light, moderate,
Right.
or intense.
Right.
Okay.
And again, like our guidelines kind of say, you know, moderate, at least moderate is a goal. And moderate intensity would be something that kind of increases your breathing a little bit and increases your heart rate. And if we were to use terms to describe it, or it would be like walking like you're late for the bus, or late for a meeting, with just a little bit more intent than what you would normally do.
A little bit more pep.
Yeah, and you know, I use the example in the talk of the Staying Alive song, you know.
Stuck in my mind.
Stuck in your mind.
Yeah, I was actually walking in the mall to it. Yeah.
And that would be 100 steps per minute, which is what we would call moderate intensity. So
that wasn't dreadful.
Yeah, that wasn't so bad.
Okay.
Now, having said that, again, the more recent evidence that's based on accelerometers and things shows that even light activity, especially in females, actually has significant improvements in health as well. So the more light activities you can accumulate, so even doing things around the house, standing more than sitting, you know, just walking to the bus, or walking that extra 100 meters when you park your car to go to the bank. Actually, those things are accumulating, and now that we have the technology to basically account for that,
I love that.
we're being able to identify that that's actually important and beneficial to people's health. The little bits of physical activity, we know, contribute to health, because that's kind of how we historically have been active, is throughout the day, but now in our modern societies, we've kind of become very sedentary.
Easily done.
Right, and so now those little bits help.
Okay, and we've got some people that are watching this, I know, especially from my news group, that have had RA for a long time, or RA or lupus or wherever, and they have old guidelines that said that when you were in a major flare, basically you go to bed, or you lay on the couch, or whatever. Has that changed, or do you still just sort of go to bed for a week and recuperate?
I think things have changed a little bit, and mostly because our understanding of movement as it relates to health has really changed in the last 10 years. And especially things like the psychological effects of physical activity. So for example, one of the things that we find is that, you know, the less people move, the more their mood, you know, decreases, and that their joie de vivre, so for lack of a better term, kind of depresses. And so that's one of the aspects, that even though somebody may be in a flare, moving as much as you can at the time is probably better than not moving at all, in the sense that there's so many things about your body that are regulated by physical activity and important for physical activity. Moving as much as you can reasonably do is probably a good idea, even in things like, you know, heart attack and various, you know, surgeries. The new paradigm, like for example, after a heart attack, it used to be 2 months of bed rest. Well, what they figured was they found out that that's actually worse. And so now, after a heart attack, they try and get people moving as soon as they can, maybe even the next day.
Hip replacements. I think they at least get them sitting up the first day. If not,
And that's where we find that the more bed rest that somebody has, the worse off they'll be from a cardiovascular system, from a mental health, from a physical health standpoint. So move as much as you can, you know, you might have to have a little bit of discomfort, but moving within those boundaries is probably better than not moving at all.
And I know that my physiotherapist 20 years ago told me to increase it by 10% if you didn't feel that you were working too hard, because you always had to walk back. Does that sort of still follow, that if you can walk half a mile, then you don't do a full mile the next day?
Right. And actually, you know what, that 10% rule has been in sports and training for a number of years, and interestingly enough,
so it wasn't just a...
the evidence has actually borne it out over time, that a 10% improvement per week seems to be a reasonable progression for most people, and that if you exceed that too high, you can run into problems. As an athlete, you would get into what's called an overtraining state, but for somebody who has arthritis or rheumatoid arthritis, that if you exceed that ability by too much, too soon, then you could, you know, run into a little bit more an inflammatory situation. So You know, if you
But
can...
10% would be a good goal then?
Yeah, so if you can walk a kilometer this week, then try a kilometer, 0.1, you know, and 100 meters next week, and go a little bit more.
That's good. That, I
Yeah.
think will answer a lot of questions on our group.
Yeah.
You mentioned diabetes, and of
Yeah.
course, all of us know that as soon as you've got one chronic illness, quite often due to side effects or whatever,
Yeah.
you will end up with the second one. And I do know a lot of us have diabetes from
Mhm.
long-term prednisone
Yeah.
before or whatever, or obesity from not moving enough.
Mm-hmm.
Do these guidelines, will that help the diabetes as well then, what you're telling me?
Yeah, for sure. And actually, one of the things with the physical activity guidelines, they're actually consistent across just about all chronic conditions now.
Oh, okay.
So the 150 minutes as a long off goal is applicable to those with diabetes, for those with cardiovascular disease, for those with hypertension, for those with, you know, a number of conditions, and it's the same because there's so many benefits to getting there.
Right.
And so from a diabetes standpoint, actually diabetes and arthritis are two of the conditions that are most benefited by being more active than where you are.
So both inflammatory arthritis and an osteoarthritis.
Yeah.
And again, in osteoarthritis, there was this idea that you had to preserve that knee. So
Yes.
you didn't want to climb stairs, you didn't want to stress it out too much.
Mhm.
Has that changed as well?
I think so, in the sense that most of our evidence shows that if you can strengthen the tissues around the joint, that you can unload the joint so that it actually has less damage accumulating, as well as doing things like balance exercises, what are called stabilization or neuromuscular exercise, that improve the tracking of the joint so that it actually doesn't have a poor movement pattern.
Yeah.
That actually can also help unload the joint. And as well, just simple mobility exercises, if there's just range of motion, and that helps to get the synovial fluid going, helps to lubricate the joint. And again, back to that whole thing that we're finding out that even little bits of physical activity are better than not doing anything at all, but progressing up to strengthening activities can help in the long term. And we understand that with arthritis particularly, that it may be painful to start, but the benefits on the other side are great. And actually one of the biggest effect sizes for exercise and its benefits on a chronic condition are in arthritis, where if you can kind of work through a little bit of that discomfort, and there will be a little bit of discomfort at the beginning, it can really improve reductions in pain, quality of life, mobility, those things on the other end if you
Which
can
is
work through those things.
All the stuff that we want a magic pill for,
Right.
but we don't have to pay for this.
Yeah, it's something that
Because
you
really
can
all we
provide
need
for
is our
yourself.
running shoes and
Yeah.
our swimming suit. Yeah.
Or a piece of resistance band that you can do to strengthen your tissues, and you can do that in the comfort of your own home as well.
Right. Thank you so much. That is so much help. I know that my sister has a senior home,
Mm-hmm.
and I'm hoping that she'll pass on some of those osteo tips to them, and I know that people with inflammatory arthritis
Yeah.
and osteo will come in.
Yeah.
So to sum up,
Yeah.
we need to maybe increase by 10% a week if we can
If you
handle
can.
that.
Yeah.
Start off light if we are not used to exercise,
Yeah.
but to move regularly. And our goal should be about 150 a week.
As a long-term
As a
goal,
long-term
and
goal,
build
way
up in
down
little
there.
steps. Yeah.
So even if we're somebody that's pretty much bed rest, I guess even if you walk to and from the door a couple times, that would be an
That's
improvement.
a journey of 1,000 miles begins with little steps.
I think you've helped to turn around an old-time paradigm. New people, we've gotten away from that, but those of us that have had it for a long time,
Yeah.
some of those ideas sort of are hard to change. Yeah. Where do you see this going in the future?
Well, I think the big thing is what we know about, dealing with chronic disease, and the idea of self-management is important. That the transition in healthcare is that we figured out that healthcare can't solve all the problems, and that especially in chronic conditions that there's more of an emphasis on self-management. And that, is a good and a bad thing in the sense that it puts a little bit more quote-unquote pressure on patients to, you know, do some education for themselves. However, it is also a good thing because it gives the patient control over their condition, and it can empower the patient to, you know, see things through with their own treatment. And that we know that, you know, taking care of diet and sleep and physical activity are things that do make a big difference in the long term. Where we're going in the future is having more resources in communities to help support individuals with chronic conditions to be active on their own, in their own environments, in their communities, without necessarily having to access medical resources to do it,
Right.
but having community-based programs like there's an arthritis maybe walking group or support group,
Okay.
or a resistance group that meets on Tuesdays and Thursdays in the church basement and that kind of thing. That, because we know that communities of support are very important.
Absolutely.
That it's one of those things to
One of my big
self-manage.
things is support of some kind.
Right. And we know whether it's, you know, somebody with cardiovascular disease or diabetes or arthritis, that you feel better when you can link with other people with the condition that can support you in your challenges, as well as celebrate your victories. And we know that when you have groups that support each other in that way through physical activity, not only is it good for your physical health, but it contributes to your mental health, your social well-being, your spiritual well-being, and that's really what we want, is we want people to be well.
And even people that are not a social outgoing person, you
Yeah.
still need to see people around.
Yeah.
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 Get a little sunshine.
Yeah.
Anita, do you have any questions from the audience?
Yeah, so what kind of exercises, like in terms of measuring your foot exercises or your steps, that's easy to do, but in terms of exercising for the hands,
Mm-hmm.
do you have any recommendation for hand exercises?
Well, most of the ones are from a mobility standpoint, like, I mean, just basically going through, you know, range of motion, you know, doing different mobility exercises for the different joints. So starting with range of motion is the first thing. And then you can progress to simple strengthening exercises just by doing simple isometrics, actually, by, you know, in a defined position against your other hand or against a support to increase some strength. And then if you can progress beyond that, you know, those little resistance balls and things, those are things that you can do that can help to improve the strength of the hands as well. But again, it's all based on what you can manage and how you
Going
can
slow
feel.
as
And,
to
yeah,
if you're inflamed in that
Yeah.
area. And
begin with mobility first, see how your body reacts the next day, and then, you know, you could progress to doing simple resistance things, and then again, see how your body feels later that day, later the next day, and see if it increased stiffness or reduced stiffness. And then if it, you know, if it progressed, well, then you can do a little bit more than you did before.
so we're still at that 10% rule.
Yeah, there you go.
And there's nothing out there that kind of measures, you know, how your hands are doing in terms of like, because there are lots of steps counter that
Right.
measure the steps, so you can
Yeah.
see a progress, but not so much for the hands.
Well, we do have grip strength, things that measure grip strength, and in fitness assessment, that's actually a standardized test that we do all the time, which is a measure of grip strength. So, you know, many fitness labs or whatever will be able to measure grip strength. So that is actually, you know, a reasonable indicator. There are some hand dexterity tests that are out there that if you know, Googled hand dexterity, there are some simple ones that can also, if you do, it's like different patterns against time. So you can actually see how good your hands are from a mobility standpoint based on, you know, different patterns that you can do. So there are a couple tests out there.
Perfect.
But nothing standardized like a, you know, band or a watch
Right.
that's of a similar style.
Well, and especially since our hands are something that we work so hard at preserving.
Preserving, yeah.
We don't do a lot of the grabbing anymore with our fingers of the loaded
Yeah,
grocery bags.
Right.
You know, we use our upper arms.
right, to try and protect
So
them.
yes, I can see
yeah.
that. Yeah.
Yep.
But again, that 10% rule, and I guess what, listening to your body?
That's a
Does
big
that
thing
pain
is
have
listening
a
and,
big
and
thing?
letting how your body feels later that day and the next day kind of be your guide. If your baseline pain has gone up the next day, well then maybe it was too much the day before. But if your baseline pain is going down the next day, that means that that was a beneficial thing, that it actually improved your fitness in some way, and that then you can progress a little bit more to build it a little bit more from there.
Perfect. I'm sure that other people will have questions as this airs.
Yeah.
If you happen to go onto the network, if you want to type in an answer, that
Okay.
would be great.
All right.
I know that for me, for example, that's staying alive, and that the moderate will not go away. And the other thing that was really invaluable to me was you had said that 3 weeks in bed equaled basically 30 years.
Yeah, that's actually one of the things in research that we were relating to the sedentary behavior that they figured out, was that 3 weeks of bed rest was the equivalent cardiovascular aging and metabolic aging as 30 years of aging.
That's a real big fact.
Yeah, that's a big
a
deal.
big fact.
Yeah.
So those of you with your grandchildren, try not to do 3 weeks in bed.
Yeah.
You want to see them for longer.
Right.
Thank you so much, Jonathan.
My pleasure.
We really appreciate it.
Oh, my pleasure.